Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
Hey, Angelique, Happy New Year.
Happy New Year, Toby. I am wondering, I have a case here from a listener. Do you think we could talk about it?
Great, let's get started with that.
All right. It's a case of, they identified it as wrong treatment, but here it is in sort of review. So this was a person, it's 51-year-old female. They're a teacher, and they came in with a main complaint. And I'm going to butcher the name of this condition because I've never been able to say it right. Is it Dupuytren's contracture? Is that how you say it? Dupuytren?
Is it the finger?
The finger contraction?
Yeah, I don't know how to say it. I only read it.
I'm going to call it Dupuytren's. Correct me, listeners, if I am wrong. Which this patient had surgery for. It was of their pinky finger on the left hand. And they had surgery in 2024 for this. It was progressively contracting, and they wanted to avoid a second surgery. So they sought out acupuncture. It was a palmar fasciotomy that they had last year where the nodule in the cord was removed. They had a clear scar along the heart channel, thickening in the proximal phalanx. They use a brace at night. It's worse with cold, use gripping. And other history is that they'd run cold in general, cold hands and very cold feet, even with 2 layers of socks. They called this poor circulation. They even wore mittens growing up in California where it was warm. They have hemorrhoids following deadlifts, no pregnancies, low sex drive, perspires easily. Stress, they reported as 3 out of 10. They do quite a bit of exercise. Menstrual cycles every 28 to 30 days with 2 to 3 days of light flow. And they have a history of autoimmune progesterone dermatitis during their luteal phase, which resulted in a huge rash over their back that had
Hmm.
pus. It got so bad and is controlled with birth control. And this listener notes that there was an odor in the room, possibly, but they were able to didn't describe here what that was. And so they just a
Yeah,
planted heart.
that's really reasonable. Usually for this kind of case, again, I've treated a few of these cases, and that
Hmm.
is the way to go because we got that cold contracture going right on the heart channel. So yeah, that's a great opening salvo. What went wrong?
So they said when they did the supplementation of heart on the right, their face got red.
Hmm.
And initially, with inquiry, nothing was wrong with the point sensation, and the practitioner continued to observe them because their face wasn't peaceful. They didn't have
Hmm.
bugged out eyes, but there was various emotions passing over with her. She wasn't able to rest, and so it took a moment. The practitioner says she took a moment for it to sink in, and then she took the needles and then supplemented the latter. And then I'm looking at some of the notes here. It's not clear. Let me look at the other set of notes I have. If she recovered enough to share that the heart 3 had felt like there was a nail in her arm, and then actually she did not supplement. So she felt because of the intensity of the reaction that the patient had that she didn't think she could talk her into doing a bladder supplementation. So they just did some talking, and she offered several options. And so the patient didn't want the reversal and not sure if this patient's gonna come back. So she
Hmm.
was just curious what your thoughts might be on this case and why, like, around the reaction and if it was something that was wrong and the usual, you know?
Yeah, I mean, the patient's presenting so cold. I probably would have done the same thing. So that's
Mhm.
maybe some comforting to whoever that is. But I mean, that rash along the bladder channel, right? That's the only heat sign we're really seeing besides cold. I might have probably just put that to the side too and supplemented heart because again, I've so many good responses to that syndrome by supplementing heart. So I might have done that. The other channel I like to take for there is small intestine, like there's over consolidation right there on the small intestine channel too. So, if you really decided to heavily weight that rash on the back, then that would have been a way to move away from that really heating of heart, and then still work with that area. Maybe supplement small intestine. But yeah, again, if patients just refuse to get the counterbalance, I don't remember ever having that experience myself. Usually the patients feel so lousy, right, that we've done the wrong thing. Usually they're happy for me to correct it. I don't think I've ever had anyone refuse to let me correct it. So yeah, that's a tough clinical spot to be in, right?
Mhm.
You started to take the patient the wrong way, especially if they realize right away and remove the needles. Supplementing the counterbalancing is ideal, but especially if it's just a few minutes of that, that's probably okay without counterbalance, right?
Mhm.
Sometimes, if it's a full treatment and I'm for sure it's wrong, I would try and insist and try and talk the patient into, we really need to correct this. But again, ultimately the patient decides. So, but from my experience, I've never had a patient refuse for me to try and help them further.
Does it sound like from the reaction that was shared that this was a wrong treatment reaction, or is it one of those times where maybe if you actually waited a little while longer, they might have settled? 'Cause I've struggled with this myself. Like
Yeah.
some people have really strong reactions to the initial needling and kind of be like, and then they seem to be okay. And then there are other folks that I feel like there's just a little bit more unease that go beyond like what I would consider the initial reaction to needle sensation, where I'm kind of like, oh,
Yeah.
I wonder if I should pull
That's
it.
where that 5 minute
About 5 minutes.
decision point is for me, right? Because after 5 minutes, that needle sensation is negligible or gone. A lot of times, especially if that breathing seems to really even settle down the point sensations. By 5 minutes, yeah, I want to feel like the patient's, again, especially if they had some of that contracture and it was starting to open up and have less contracture, then even if they're a little bit more red faced or something like that, sometimes that will happen with supplementing heart, right? It should be a good red, though, not
Hmm.
like a beet red or a really blotchy red. It should be a good pink red. And then and if the finger's actually doing better, then yeah, I'm more likely to do that. It sounded like this was just all bad though, right? This patient didn't get anything positive from the note.
I mean, it sounds like there was the needle insertion, and over the course of a few minutes, all of this happened. And then the needles were taken out. And I don't know that this patient is going to come back because it doesn't sound like the patient wanted to have further needling.
Yeah.
And I don't know if this is the case. I know personally it's been my fear of hurting them a second time
Yeah.
that has been sort of, how do I say this eloquently? So when I have done wrong treatment, especially earlier this year, let's say, in my the earliest of my early days, right? When I've done this and been like, oh, because it hurts, okay? And so you're hurting someone to help them, and you mess it up, and then you have to hurt them to fix it. And so I know myself personally that I have likely conveyed the energy of not feeling super confident. And even if it's not coming across in full force, I think there might be an energetic component to the
Yeah.
patient that kind of feels like, uh-oh, and because I think if we present with like, okay, so we're going to do the other side, this is what we're going to do with this, and you're going to
Yeah.
feel better, and just present it as solid facts, less likely I think to get refusals, because I've done that since then and have not experienced the absolutely not. It's usually when I have felt not confident that I have gotten the refusal for correction
Yeah.
personally. And I don't know if that's
I,
the case with this person.
I feel like patients can sense if you're there to help them, right? And so for me, right, if I've done exactly the wrong thing, then I'm just there to help also, right? So I
Hmm.
don't, again, the needle sensation is what it is, but I'm there to help them. And I think, yeah, I think you're right. Yeah. As long as patients can sense that, then they're not, yeah, I mean, I guess the needle sensation is really painful, and then plus they're getting the wrong channel, right? It's pretty disconcerting for the patient, but if you can just say, "Well, I'll fix that,"
Hmm.
that's it's usually acceptable for the patient, right? Because yeah, they're there to be helped. So again,
Definitely.
from our theoretical standpoint, too, this,
Mhm.
this is a really valuable information. If we've done exactly the wrong thing, then we're really it really guides what the next thing to do is.
And I've sort of cribbed on you in those situations and been like, "Great, I know now exactly what you need."
True, it's
Yeah.
true. So
Yeah.
it's nice to share that with the patient.
It's all good. It's like an
But
exploration.
but you're right. Yeah, the differentiation with that, I feel like that within that 5 minutes, you'll know, right? Is this
Mhm.
definitely wrong or definitely right? Yeah, it's hard to make that distinction, especially if you're a little bit nervous about it, or especially new to using the system too. That's hard to do. But over time, right, that'll be really clear where it's just either reacting to the needle sensation or you've done the wrong thing.
Yeah. And it's a tough, it always feels awful when these things
Yeah,
happen. It's happened to me. It just feels awful. So we're not alone out there to
that's
the
right.
listeners. It's like this happens to everybody.
But you should do it less. Yeah. So that's comforting, but that's the worst time what practicing the sound system is now, and then it
Hmm.
would just get better.
Yeah. We just have to go through the hard knocks as you're learning.
There's no way of going around that. I
Yeah.
wish there was.
Me too. Me too. Goodness. If you ever figure out a way, do share.
Okay, I think it's time in the boat, and then
Yeah.
you become a better sailor.
Yeah, exactly.
Okay, anything more about that case?
No, that was it. I think your response was helpful. Actually, do you consider, now that I say that, do you consider contractures, can that be in the realm of hyperfunctioning?
Could be, but
Mm,
it's more likely floppy is usually more hot and more contracture is more cold.
I
Usually,
see.
it could be, yeah, it could be, but like the vast majority of contracture is cold. That's my limited clinical experience. I found that, and I mean that's straight from my teacher too, right? About that hypofunctioning of the joints, and then hyperfunctioning, everything's just all floppy.
I see. I had it the other way because I thought of contracture as being like a hyper, because the sinews are tightening, like everything is tight.
Yeah, I could see that, but it's the cold that's doing that, and the heat's that
Okay.
keeping everything loose.
I
Mm.
think that will be very helpful to this particular
Okay,
listener.
great. Yeah,
Yeah.
so many nuances, things to do. So, but
Hmm.
yeah, so this one in that case just a little bit more. I think I would have let that ride a lot longer, just supplementing heart, just
Hmm.
because of my clinical experience that's been so helpful for that pattern. So even if it was red faced and heart 3 felt like a nail, right? I'd still like, well, let's give it a little more time and see. So. But again, without that clinical experience, then, you know, yeah, it's hard to make that
Yeah.
decision, even with clinical experience. And then without much clinical experience, it's even more difficult.
And I'm so glad that we can talk about it and share these cases so that everyone can learn. So I deeply appreciate. Thank you, listener, for sending that in because I think that's helpful. And I just learned something that I didn't know as well.
Yeah, again, the system's so straightforward, but just the applications of it to the 10,000 things. I'm so glad you're willing to talk about this in public, because then it's nice as we talk about things. Then yeah, we should be able to make things more clear.
Yeah.
All right, I was going to check in with you. How's everything going with your self-cultivation for your clinical work?
My self cultivation with regard to in general, like
Yeah,
my
do you have formal self-cultivation practices or
I do yoga. I was thinking of it because I was thinking of we had a conversation before about self cultivation in general, and I think just I had attached that to actions or things that I was doing, but actually, I think my biggest self cultivation is in not doing, trying to really rein it in. And I didn't realize that that's what that counted, but it actually counts. Isn't that crazy? And then I thought about it. I was like, of course that counts. So I've maintained the 3 day a week clinic
great?
schedule where I work Monday, Wednesday, Friday, and I Tuesday, Thursday I don't see patients. And I've really felt the difference from when I was seeing patients 4 days a week. It's much nicer. It just if there's a wave that I
Yeah,
ride. It's like I bring myself up, like you had mentioned, and I'm there for patients, and then I've got a day where I don't have to have that level of intensity. And there's other stuff to do as a small business owner on my own, of course, but bringing the clinician part of myself forward on an intermittent basis feels better to me than working more than that. So
yeah.
I'm grateful.
And the Psalm system asks so much from its practitioners, right? So that's why I feel like yeah, it's taking so much from you to be in clinic, and then I just always think you have to put something back in. Yeah, so I think it's great, especially yoga.
Mhm,
And then just not being too frantic on the time then you're not being in clinic. I think it's valuable, right? Let
mhm,
that field be a little fallow for a little bit, so then it can produce again. Otherwise, yeah, I don't know many clinicians that work 6, 7 days a week, right? And that can maintain that really high level, right? Because again, then the field never gets to be fallow. They're just always trying to produce from there. And then I've known personally a couple of clinicians that just crash from that because again, it's not like you don't have to put yourself all the way into your clinical work, right? It's not like you can hold back and keep some reserves, right? You really have to be there fully present with the patient. So in order to do that, you have to take some time back so you can move forward into your
mhm.
clinical work.
Finding that balance is challenging. I think. And there's the reality of the financial aspect of it. Some people I don't think can do that.
Yeah.
I've chosen to do that for multitudes of reasons. And it seems to be working. So I work longer days, 3 days a week, and I prefer it. And I'd rather
Yeah.
pack in more patients on those days than sprinkling them a little bit more diffusely across the course of an entire week.
Right. Yeah. I mean, depending on what your patient population is, but yeah, instead of doing it 5 days a week or like you were doing 4 days a week, putting it into longer 3 days, again, that worked really well for me. And then I'm pretty sure I told you that's just crib from my teacher, Dr. Wu. She would see up to 150 patients a day, right? But only 3 days a week, right? You couldn't, this is impossible to do that other times, right? She would, again, her field would be fallow on those other days, right? And she was a Taoist, so she did a lot of Taoist self-cultivation and things like that on those other times, so that you could be really present and really effective for especially that volume of patients. It was just
Right.
chaos in that clinic.
I still
But
can't conceptualize the palette.
yeah, but she just smoothly moved through the whole thing as the chaos went around her.
I
Again,
believe you.
because all that self-cultivation, right, that stays with you, right? That really serves you.
And it's probably more Western, but I also prioritize what I instruct my patients to prioritize, which is like the 4 foundations of health for me, which is sleep. Sleep is huge. Got to prioritize the sleep, nutrition, movement, and then stress relief. So I really like those are the 4 things that I try to prioritize on a daily, just so that I have the ballast to function.
That's stress relief for you. That's yoga or something else you do, or is yoga the main stress relief part of that?
Yoga is the main any sort of movement. I'm kind of a walking cheese stagnation person. Movement is really helpful and therapeutic for me. So any
Yeah.
form of it's either walking. If it's too cold, I won't walk outside. I hate the cold. But usually walking outside when the weather's temperate or walking inside on a treadmill when it's not. So a combination of those 2 things are really helpful for me. And I notice a
Great.
very large difference if I fall off a good schedule.
Yeah, but I think it's so valuable, right? Because you're going to tell those patients about those 4 foundations, but especially if you're embodying them yourself, then
Yeah.
it's just so much more, it's so much more weight. I remember another one of my patients, they had just gone to seeing somebody that was like counseling them on nutrition, but they were grossly overweight. And I mean, you can't do that, right? You can't you have to live it and then you can share it, right? You can't just
Yeah.
intellectualize it and say things. Again, you're doing those 4 foundations, then that'll naturally inspire patients. They might even ask you what you do, and then you can share. It's just
Yeah.
so much more powerful than giving them, a bullet point list of you need to do these things. So
Yeah.
great. I think it's so great. We have to embody health ourselves so that we can inspire it for our patients.
Yes. Martha Beck says you got to live it to give it.
Okay,
That's like a
that's
little
a
quippy
snappy
thing.
way. Now I'm going to put that in my head because that's
Yeah.
the
You got to
snappy
live
way
it
of
to
that
get it.
long going around I was doing. All right. Anything else you wanted to discuss today?
I don't think so. Nothing's coming to top of mind at this moment, unless we go into the topic of changes of business practice, which you can decide whether or not we talk about that.
Let's do it next time.
Okay, that sounds good.
Okay, great. Let's wrap it up for now then.
All
All
right. So,
right. Well, take care.
right. Bye.